Alzheimer's Disease International, based in London, England, recently released their annual World Alzheimer's Report. This is a prestigious report recognized around the world. I was very fortunate to have contributed an article to this report in 2022 on the topic of planning for the transition of care. Well, this year's report delves into the results of an international survey analyzed by the London School of Economics and Political Science, consisting of more than 40,000 responses from people living with dementia, carers, health and care practitioners, and the general public from over 166 countries and territories. It was just a massive survey. And the result of this survey is a follow-up from a 2019 Attitudes to Dementia survey that was done and explores how perceptions of dementia have or perhaps haven't changed in the span of 5 years. Well, I'm very proud to have as our guest one of the world's leading neurologists with a specialty in dementia, Dr. Serge Gauthier. Dr. Gauthier is an emeritus professor in neurology and psychiatry, McGill University, and he's also the co-lead of the Dementia Education Program at McGill. He's also been a major contributor over the years to the annual World Alzheimer's Report, including being the co-author of the report in 2022. Dr. Gauthier, welcome back to Life Unrehearsed.
Good afternoon, Matt.
Good.
Hello to the audience.
Well, thank you very much for taking some time here on a Sunday, Dr. Gauthier. I first want to start off with a congratulations. You were part of the group, recently announced, part of the group of Douglas researchers among the top 2% of the world's most influential scientists. Congratulations on such a nomination and recognition.
No, it's great teamwork indeed. And a lot of volunteers from our community. They are part of an observational study that's been running for 10 years. And many thanks to the public who volunteers their time, blood, and spinal fluid.
It certainly is a team effort, both scientific and the public, like you say. So congratulations on that wonderful group of researchers at the Douglas. Now, let's get into this most recent World Alzheimer's Report, some fascinating findings in this year's report. Can you give at a high level some of the key findings?
Well, you did a very nice job at summarizing how it was put together. Indeed, it's 40,000 plus people who answered the questionnaire, and most of the questions had already been asked 5 years ago. So the interest of the authors was to see if there was a change for the better or the worse or what. About knowledge, about dementia, attitudes, and behaviors. Behaviors in the sense of do you help your neighbors who has dementia? Is there discrimination? And as you can expect, we need to do a better job at educating the public about dementia.
You know, some of these findings were actually, I was going to say shocking, but really, Dr. Gauthier, as you know, it should not be shocking and not surprising. Some examples: 65% of health and care professionals incorrectly believe dementia is a normal part of aging, and 80% of the general public believe dementia is a normal part of aging. There's a real stigma, but dementia is not a normal part of aging. Isn't that correct?
That is correct. If you live over age 90, maybe you have 1 out of 3 chances or risk of having dementia, but that's certainly not everyone. And I think we expect more of the people currently aging to show a delay in emergence of symptoms, because baby boomers, the big cohort that is now aging, the tail end of that group, we've had better education, we've taken care of our heart. Each generation, there's a generation effect that we expect, and hopefully this will translate into attitudes about early diagnosis and treatment and taking care of your neighbors.
And I love that, taking care of your neighbors. And you've been a big proponent of trying to change this attitude and stigma. I try to do it a lot here on Life Unrehearsed. But some other examples from this latest World Alzheimer's Report: over a quarter of people globally incorrectly believe there is nothing we can do to prevent dementia. Also not true. Your lifestyle can be a significant factor. In fact, there's 12 modifiable risk factors to dementia. Now, Dr. Gauthier, you've talked about these risk factors. Can you sort of summarize some of the more important risk factors that are indeed modifiable by each and every one of us?
Indeed, and it's gone up to 14 now
Oh,
over
really?
the year. Yes, there's two more. One is about controlling the blood cholesterol if it's too high, despite exercising and watching what you eat. If it persists high, the bad cholesterol, if you need a statin, just take it. It's good for the heart. It's good for the brain. The other finding is bad vision, impaired vision, like cataracts. Fix it because. It's a risk factor that is treatable. It will increase your access to people, to reading, being aware of things. Other factors that were known prior, some may surprise the audience, such as impaired hearing, because it's so common that if it was correctly dealt with, like you get a hearing aid if you need it and you wear it, that would be one of the major factors that could be modified. So you have a better connection with your environment. We're not sure the mechanism of the impaired hearing and dementia, but it's one of the most modifiable factors. One that you may have heard about this week is head injuries. Even hockey players are now at risk, not just football players. So that's a practical thing. If you ride a bicycle in Montreal, wear a helmet.
Yes, and in fact, that hockey one made the news for sure, and important.
Indeed.
And you know, I'm talking with Dr. Serge Gauthier here on Life Unrehearsed about the latest findings in the World Alzheimer's Report, and as we've talked about before, Dr. Gauthier, the obvious ones like physical inactivity and smoking and excessive alcohol are obviously important, but I think one that stands out is social isolation, which we're hearing more and more. Can you elaborate a little bit on that?
This was a finding from the pandemic, how hard social isolation was for our seniors, especially those who already had mild dementia. They certainly got worse quickly. Social isolation is certainly a modifiable factor, but we need to be nice to your neighbors. If you retire, you should get into action immediately. If you had a dream of cooking for the community, community kitchen, just do it. If you want to join a book club, it's better than reading alone on your iPad. Get a dog, and then you meet people. It's a very social activity, I'm finding out in Hudson.
There you go, in Hudson. Lots of dog walking there. You've got the social aspect, you've got the physical aspect. We were talking with Dr. Serge Gauthier about the World Alzheimer's Report. It was recently introduced in this fall, the 2024 report, and it really is something that we were just discussing some of the highlights and the key findings in that report. And Dr. Gauthier, I believe you're back. You're there, are you?
Yes, I'm there.
There we go. Okay. I'll finish this up with one of the findings that I found very interesting, probably one of the most fascinating ones. More than 90% of carers and respondents from the general public said they would be encouraged to get a diagnosis of dementia if a disease-modifying treatment for dementia was available. And I struggle with that one because, you know, I'm under the impression there is no cure. There's not much you can do to reverse it. But is there such thing as a disease-modifying treatment? And how has the pharma and medical research been doing lately? Because it's been a long, long road.
It's been indeed a long road. The main target has been amyloid. That's the protein that builds up in our brain as we get older. It's not sufficient to cause symptoms. There's another protein called tau. That's a Greek letter, tau. And possibly small strokes that are silent in most people, and the three factors together, they lead to dementia. The novelty is there are medications now available. They're under review by Health Canada, two of them, to take out the amyloid out of the brain at the stage where you have symptoms. The earlier, the better. So that if the drugs are approved, we will know hopefully between now and the new year. It will change people's perspective, as you quite rightly mentioned. People will come forward perhaps sooner than before for early diagnosis because there's hope for a treatment.
It's very encouraging, and I'm quite surprised. You're saying there's going to be more information coming out before the end of the year, and it has been there's worldwide hundreds of millions of dollars being done to combat this disease, and it's still a long ways to go. You personally have been involved in a lot of that research, but it is encouraging that there are signs, and all the more reason. I mentioned just before traffic. Dr. Gauthier, what are some signs that someone may be in the early stages of dementia? What do we need to be looking out for?
It's mostly the people you live with that may notice something significant. Because all of us, some days we're not as sharp. We're looking for our keys. We're looking for something. We went to the basement, and why did I go? That's normal. But if your loved one, your friends, your co-workers worry, especially your daughter, then it's more significant. And that could be lapses of memory for things that you used to do well, like go pick up the grandchildren at school on time, or withdrawal from social activities that you were good at, such as playing bridge, or the grandma who used to prepare dinner or lunch every Sunday for the family, and now she's not so interested. It's probably because it's just overwhelming to plan the meal. So it's mostly a change in habits that could involve complex hobbies, such as bridge, or day-to-day activities, like someone who's not taking their pills regularly anymore. Sometimes the pharmacist picks it up, and then he may notify the referring physician. So it's often someone you live with that will pick up that there's a change that requires an assessment.
Listening to Life on Rehearse, Matt Delvecchio here, and I'm talking with one of the world's leading experts in dementia, neurologist Dr. Serge Gauthier. We're so blessed to have Dr. Gauthier right here in Montreal. And, and you've always been a big proponent. We all have seniors moments, okay? That's not to worry about. We'll forget things, but you've just described very well the difference between a senior moment, forgetting something, versus something a little more complex, and usually a loved one will pick that up. So if a family is concerned about a loved one starting to experience some of these signs, what should family members do?
Normally, you go see your family doctor. If you don't have one, you try to find out if the Groupe de Médecine Familiale, the group of family doctors in your area, has one of the doctors with a special interest in memory or cognitive changes. There's supposed to be one. And a nurse also is involved in testing paper and pencil testing. So in an ideal world, you have access within 3 months to a family doctor who has a special interest and expertise. And then it depends on the age of the person, their social responsibilities, the availability of new treatments will be a big factor, how quickly you're referred to see a specialist. But currently, if you're over age 80, if you need a specialist, it's likely to be a geriatrician because you have other diagnoses like high blood pressure, heart disease, kidney disease. If you're 60 to 70, you may see a neurologist because you're young. If you have mostly behavior problems, it's something we forget sometimes, but Alzheimer dementia may start with being paranoid about people taking your money, or very jealous about your husband. If there's a big behavior problem, then maybe you see an old age psychiatrist or psychogeriatrician.
All different examples of that. And you brought up some very good examples. You also used the term dementia and Alzheimer's in the same sentence. And Dr. Gauthier, I love getting your opinion on this because dementia and Alzheimer's aren't the same thing. What is the difference?
It's the classic question. I'm glad you asked. Because Alzheimer's disease is a change in the brain that occurs in most people as we get older, but only some of us get symptoms. Dementia is a clinical syndrome. It's by definition a decline in some of your abilities involving memory, judgment, words. It affects your daily life. And the cause can be Alzheimer, can be multiple strokes. Could be one big stroke in a strategic location. It could be Parkinson's disease or a mixture of all these conditions. Often it's a mix, which will make it hard to find one drug or treatment that will work for everyone. We'll have to be able to measure in that individual with symptoms what's going on in his or her brain at that time, and what is the main cause that we can work on, such as amyloid, tau, inflammation, some subtle change in the way the sugar is used in the brain. And the good news is working on all of these at the same time. It's not just about amyloid. It's also tau. It's also preventing stroke. What's good for the heart is good for the brain. That has worked well in Ontario. We should really have a policy like that in Quebec.
Mm. Well, I like that explanation. Dementia, almost kind of an umbrella term, because there are different forms of dementia: vascular, frontal, temporal. Alzheimer's being part of that group, where Alzheimer's is part of that dementia umbrella. So much more to learn. It's very encouraging, Dr. Gauthier. Every time I have you on the show, it seems to be there's little progress and lots of progress, but it's certainly encouraging. As our population ages, this is just going to be more and more prevalent out there. We're going to hear about this more often. So I want to thank you for taking your valuable time here on a Sunday to inform us and our listeners.
It's a pleasure. Good afternoon to all.
To you as well. It's Dr. Serge Gauthier, Emeritus Professor in Neurology and Psychiatry at the McGill University, and he's the co-lead of the Dementia Education Program at McGill. You've heard me have Claire Webster on on our program as well, very much involved in that Dementia Education Program. Wonderful that what McGill is doing there.